welcome back to the SL TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, share, and subscribe. And do not forget to come back for more. See you soon.
Welcome everyone to this explainer. Today, we're talking about a truly life-saving routine, cervical screening. We are going to demystify the pap smear process from start to finish. We'll cover the screening basics, walk through a step-by-step patient guide, and look at the essential testing facts. The goal here? To make sure you walk away knowing exactly what this test is, why it's done, and how you can take charge of your cervical health with absolute confidence. Let's get right into it.
Now, you might be wondering, do you really need a screening if you feel perfectly healthy? It's a completely normal question, right? It is incredibly easy to feel anxious about the exam, or maybe you think you can just skip it since you don't have any symptoms. But here is the absolute crucial point. Abnormal changes in the cervix. They often develop without causing any noticeable signs at all. Literally none. You could feel 100% healthy and still have precancerous cells developing totally under the radar.
Section 1. The basics of screening. Okay, let's dive into this. What does this test actually do? Well, a pap smear or pap test is a screening tool specifically used to check for abnormal cells in the cervix way before they ever have the chance to develop into cancer. Basically, a doctor collects a small sample of cells, then those cells are either spread right onto a glass slide or they're put into a vial of liquid, a method called liquid-based cytology. From there, experts check them out under a microscope for any precancerous changes. And here is a powerful, highly encouraging number to keep in mind: 80%. You see, cervical cancer usually develops incredibly slowly, often over several years. Because of that slow growth, finding and treating these abnormal cells early through a routine pap smear prevents up to 80% of invasive cervical cancers. That is huge. It's literally one of the most preventable cancers we know of, largely thanks to this simple screening. Section 2. Preparing for your appointment. So before you even step foot in the clinic, there are a few things to do to ensure the absolute most accurate results. Basically, you want to give your cervix a 48-hour rest before your appointment. That means skipping sexual intercourse, douches, spermicidal creams or foams, and any vaginal medications, unless your doctor specifically tells you otherwise, of course. Avoiding these just makes sure the cell sample is clean and clear for the lab. Another quick preparation tip. Try to schedule your screening when you are not menstruating. Now, technically, a pap smear can be done in some situations during your period, but menstrual blood can actually obscure the cervical cells. Keeping your schedule clear makes the sample a whole lot easier for the laboratory to interpret accurately. Section 3. Inside the exam room. The procedure itself is incredibly quick and straightforward. First, you'll lie back on the exam table with your knees bent and feet supported in rests called stirrups. I know. Definitely not anyone's favorite lounging position, but a necessary one. Second, your healthcare provider gently inserts a speculum to hold the vaginal walls apart so they can clearly see the cervix. Third, a small, soft brush or spatula is used to collect the sample. And fourth, that sample is sent off to the laboratory. And that physical collection with the brush, it really only takes a few seconds. Let's address the elephant in the room and the absolute most common question patients have. Does a pap smear actually hurt? While everyone experiences it a bit differently, most people describe it as causing mild discomfort or pressure, not actual pain. The whole thing is over super fast, and you can usually get right back to your normal activities immediately after. And hey, remember, if you do feel pain, speak up. Your healthcare provider can easily adjust the speculum or just pause if needed. You are totally in control. Section 4. Understanding your results. When your lab report comes back, it uses a standard reporting format called the Bethesda system. Let's decode those acronyms so you know exactly what they mean. NILM means your result is completely normal. No abnormal cells were found. ASCUS means some cells look slightly unusual, but the cause is a bit unclear. LSIL indicates mild changes, which are actually often linked to an HPV infection. And finally, HSIL points to more significant cell changes that require further evaluation. And this brilliantly illustrates why we test. But even if you see an abnormal result, like LSIL, don't panic. Seriously, these changes often resolve completely on their own or just require some careful monitoring. Section 5. Pap smears versus HPV tests. People often get these two confused, so what is the mechanical difference here? Well, a pap smear looks specifically for abnormal cellular changes in your cervix that could eventually develop into cancer. An HPV test, on the other hand, looks for the viral DNA of high-risk types of the human papillomavirus. And that's important because that virus is responsible for almost all cases of cervical cancer. Now, especially for women 30 and older, healthcare providers often recommend what's called co-testing. This simply combines both the pap smear and the HPV test during the same visit. And thanks to modern liquid-based cytology, the laboratory can actually run both of these vital tests from the exact same specimen collected during your exam. It's incredibly efficient. Section 6. Your screening schedule. So when exactly do you need to book these appointments? Well, according to the American College of Obstetricians and Gynecologists, if you're between 21 and 29, the recommendation is a pap smear every 3 years. Notice how things shift as you enter your 30s. From ages 30 to 65, you can have a pap every 3 years, an HPV test every 5 years, or combine them for co-testing every 5 years. And once you're over 65, screening might not even be required anymore if your past results have been consistently normal and you aren't at high risk. It's also really important to note that guidelines can definitely vary by region and by your own personal risk factors. For instance, the World Health Organization recommends HPV DNA testing as the preferred method where available, starting at age 30 for the general population. But for women living with HIV or those with weakened immune systems, they require more frequent screening starting at age 25, simply because they have a higher risk of developing cervical cancer. We're going to wrap up this explainer with a really powerful thought. Looking after your health isn't only about seeking treatment when something feels wrong, it is also about preventing problems before they begin. Cervical cancer is one of the very few cancers we can actively prevent with routine checks. So, let me leave you with this question. If a simple 5-minute test could stop cancer before it even starts, isn't it worth enduring a few seconds of awkward stir-ups? Check your calendar, know your status, and take charge of your cervical health today. Thanks so much for joining this explainer.
Please subscribe.